Child-parent psychotherapy is a dyadic model, which means that it is delivered to a child and their caregiver. Much of that work is happening at the same time. The model is designed for children in the first 5 years who have experienced trauma and or have attachment issues, who are living with caregivers who have experienced trauma and or are having their own attachment and mental health issues. It's generally somewhere between 30 and 50 sessions that occur over the course of about a year. And those are weekly 1-hour sessions in the home. One of the things that we really emphasize in child-parent psychotherapy is that the first fidelity is to the family, that we always want to make sure that we're doing what the family needs, but that we recognize that families really have what they need within themselves. And if we can provide some support, some emotional support, but also sometimes concrete support, and help them to sort of understand their child from a different lens, that families can really do what they need to do to get to a better, healthy developmental trajectory. But it starts with developing a really solid relationship with the caregivers. We have some research on this. We've done a randomized controlled trial on using mothers who were experiencing depression. We've also had research looking at children who had experienced physical maltreatment in the context of their caregiving relationship, and several other groups. And across the board, what we found is that both children and caregivers' post-traumatic stress and depressive symptoms get dramatically better with this model over the course of about a year. We see improvements in parent functioning, improvements in the parent and child's perspectives of one another. We see children and caregivers having more secure, organized attachment relationships with their caregivers. And of course, when we start targeting their attachment relationship, so many good things flow from that, because then we see, children whose IQ scores are then tracking with community samples rather than seeing what sometimes happens, which is as children experience trauma early in their lives, that can actually compromise their cognitive functioning. So we can help with that by getting them into child-parent psychotherapy and back on a healthy developmental trajectory. Another study noted that children who were in the foster care system who experienced child-parent psychotherapy had fewer placement disruptions.
Some of the benefits that I've seen from doing child-parent psychotherapy have been the family relationship. The client is the child-parent relationship, not just the client or just the parent. And so seeing them be able to fall into a more comfortable, healthy, and safe relationship has been one of the greatest benefits that I've observed as the clinician. But then I think this model also sets us up very well to observe and quantify the benefits and outcomes. So seeing significant decreases in trauma symptoms, sometimes so much so that children no longer meet criteria for PTSD. And from a parent standpoint, a lot of parents will come in with anxiety or their own trauma symptoms, and so simultaneously seeing decreases in their symptoms as well, more confidence as parents to be that secure base for their child.
There are so many things that make this model absolutely incredible. It is so energizing to watch what happens in families. I think this idea of helping caregivers and children to be able to see one another and see their positive intention toward one another and feel safe and then experience joy from there when they've kind of often come in feeling really hopeless is just a really, really amazing experience.
My passion for child-parent psychotherapy comes from wanting to get that early intervention. My passion for becoming a therapist was to do trauma work, and so getting that age group with their caregivers in these sessions that involve both of them was really the reason why I wanted to get trained. They feel much more confident, and hopefully you've broken the cycle for one family and another family as you continue providing this intervention.